As the opioid epidemic is a known thing, that was an area of need within our program and also an area of need within Kansas City.
Kansas City, Kansas is historically a low-income community that has little access to resources and high poverty.
What we saw when we started looking around was it was pretty hard for our patients to access buprenorphine at pharmacies because it wasn't in stock.
It's hard to find specialty services that accept Medicaid, and when you do, there are long lines and big waits. Now, family medicine serves a number of those people already, so they were our patients, and we wanted to ensure that they got the services they need.
Doctors Witt and Corvo and Butler sort of really helped jumpstart that within their own clinics, but eventually turned into what we call the recovery clinic.
And what we found is we found it awful lot easier to prescribe large amounts of full agonist opioids than to get people on buprenorphine for medication-assisted therapy.
We decided that having a session kind of focused on this and using the flipped classroom technology or design would be very helpful for the students so that they could watch these lectures on their own time, but then come together on a Tuesday morning and do a debrief on what they've learned, but also take time to apply what they've learned to actual patients.
So my colleagues went to work thinking about how to involve teams remotely, how to do virtual teaming, as it were, both with a virtual patient as well as with a patient physically in a clinic room. I think it's worked really well. It's of course been a learning process and there's been a lot of orientation to do with the teams along the way. But because of their hard work, we've been able to keep our program up and running to a large degree despite the pandemic.
You can make providers comfortable making the kind of referrals they need to make to Suboxone or buprenorphine clinics. And then when you can make them comfortable providing the treatment, that's important.